Don't say bad
What?
words.
Okay, girl.
Yeah,
Come on.
get your pearls on. Okay, wait. Let me make sure it's recording, like, the right stuff. This computer thing's hard.
I know, Screwmatic. It's so hard
It
to
sucks.
use.
Yeah. Oh.
Oh.
What's that?
Hi, that's the bedroom in our basement.
Oh, cute. Okay. Okay, so we're just gonna start off with you, like, talking about yourself and why you went on Accutane.
What?
So, okay. So you can you can start by, like, saying your name and, like, your job and just whatever you want.
Okay, good. I'm so excited to be here today on your podcast. And I started Accutane about 3 months ago. And that was for adult acne. I tried everything else on the market prior to being on Accutane. I was on another drug for quite some time.
What was that drug called?
It was called Cefton.
The one you have right there?
Yep, the one I happen to have. Here.
Perfect.
All right, there you go.
And are you still on that?
I'm not. I was on it about 10 years.
For acne?
Wow, that's a long time.
Oh, I was on a long time for a long time.
Did that have any side effects?
I did not, no, but it's it is an antibiotic, so I am now immune to that antibiotic because I was on it too long.
Oh, yeah, I bet. So, okay, so you were on Accutane for a while, and then you got off for 2 weeks, and then you got back on.
Right.
Why'd you get off of it?
Well, I just wanted to see what would happen after I'd been on it for a while, to see if acne would come back, and if my skin would come back to normal because it was super dry. And so I just wanted to see what happened with that. And then, of course, things started to come back. So I went back on Accutane, and then after speaking with the doctor, she said I needed to be on it for at least 4 to 6 months at a minimum.
Yes, that's what I've heard. Okay, we'll start with the questions now. Ready? I'll ask, and then Madison will ask, and then I'll ask, okay?
Okay.
So, we already went over the medications. It was only that one, right? Or did you try any, like, topicals or anything else?
Well, over my lifetime, I've tried everything pretty much, so...
Lots of, like, face washes and...
Face washes, tetracycline, doxycycline, minocycline, so quite a few.
Just everything.
Everything.
So you tried, like... I know that doctors like to recommend everything before Accutane because of how strong it is. You did that?
I did.
Okay. Madison, you can ask the next question.
Okay. What made you decide that you wanted to go on Accutane?
Well, I needed to get off of the antibiotic, and the doctor, she knew that I had tried all the different types of medicine, and this really was the final step to trying to clear up acne.
Yeah. Okay. Good to know. What side effects did you experience? And how long did it take to clear up?
So, to clear up, it actually was pretty quick. It was less than 30 days.
Really?
However, the side really,
Wow, normally it takes a couple months.
Yeah, no, it was really quick.
Did you have, like, a purging phase?
Not really, no.
Wow.
It dries everything up really quick, including your skin, your arms, your lips, your nose, everything gets dry. So, your mouth gets really dry because it's taking all of the,
the moisture or whatever?
The moisture out of everything. So,
and that's all that you experienced?
That was really it, yeah.
There wasn't any, like, dizziness or nausea or any of that stuff? Mostly just dry skin?
Yeah, basically dry skin. Maybe a little bit of blurry vision for night driving, but it is gone now.
Okay, that's good.
When you went off of Accutane, what did you experience? And then did your skin stay the same, or did it begin to break out again?
No, when I went off Accutane, my skin changed. I didn't really break out, but my skin definitely changed and became much more oily. And I didn't start to break out, but my skin started to hurt like I was going to break out. You know, like it was going to start again. So that's the one thing that I really noted. And that's why I went back on.
We have this quote from Morales Cardona and G. Sanchez Venegas. It says, a total of 142 patients were followed up for 24 months or until relapse occurred. The relapse rate was 15 events per 100 person year of follow-up. The risk of relapse was twice as high among men, which is probably why you experienced it. Right. And the protective effect of maintenance treatment with topical retinoids was 32% for each month of use. The risk of relapse was 3.5 times higher among women not receiving anti-adrenaline therapy. So that's a lot of people who actually relapse.
A lot, yes.
I didn't know it was that high.
That's why the doctor said I needed to stay on it a longer period of time so that it didn't come back.
Do you know if, like, after you go off, do you stay on topical, like, solutions, or do you not know?
I have no idea.
Yeah, me neither. We'll ask the doctor that.
Right? Yeah, ask the doctor that. Ask Dr. Schultz.
So the next question is, did it make your skin sensitive to, like, different, like, moisturizers or anything like that?
It didn't make it sensitive, but what it did do is made it really smooth.
Oh, yeah?
Really soft and smooth. So it definitely changed the
texture.
The texture, the elasticity of my skin.
Even during the off period, or no?
No, went away. Yeah.
Okay.
And then how long did, like, when you were taking Accutane, how long did it take for you to start to see, like, improvement in your skin?
Right away, I would say within 30 days, wow. I saw improvement, and then the smoothness really came at about somewhere between the 30 and 60 days, where my skin actually just felt like.
Good. That's really fast.
Yeah.
Did you notice any, like, right away, like, just, like, your pores, like, started to shrink or anything like that? Even, like,
definitely on my nose. Yeah, definitely on my nose. My pores shrunk quick.
That's really cool. That it is so fast. Let's see. Do you follow any kind of skincare while you're using Accutane?
I do not. No, just Accutane, washed with soap and water.
No, like, moisturizers or anything?
Not really. Because it was actually felt like it made my skin more oily when I was moisturizing.
Yeah.
So it just didn't. It just didn't feel the best. So I didn't moisturize at all.
Did Accutane make your skin worse in the beginning of your treatment?
No, not at all. Not one bit. It the only thing that made it worse was it just dried. It dried it out quick.
Did it hurt when it got dry?
It did. Yeah, because when things get dry, they start to crack, and my lips were just, horrible.
They look better now.
I do keep chapstick everywhere. In fact,
well, I've seen that a lot of people tend to, like, purge for a while, and then it starts to clear up, but then, like, they always have to be putting moisturizer and chapstick on. I don't know how you don't do that.
I do chapstick all the time.
Chapstick?
All
but
the time.
Not moisturizer. I can't live without moisturizer.
No, me too.
Girl.
Okay, then we have, like, one final big question. So we want to know your opinion on what you think about Accutane, like, weighing the risks and the benefits. Like, what's your final opinion?
Well, with men, there's not a huge risk factor.
Mm-hmm.
So I was okay with it just because there isn't a huge risk factor. There's a ton of side effects that could happen, but they're typically not common in men. With women, it's a whole different story with the side effects. So I was fine with what could possibly happen, because if you stop taking it, those side effects would go away.
Yeah.
Right. So I wasn't too concerned with the side effects in men.
Yeah, the women's side effects are much more severe.
They're definitely more severe.
Yeah.
Yes.
Will you show your package of Accutane with the pregnant women and the crossed out circle thing? It's crazy.
Oh yeah.
It's right on the front of the package.
And then inside, that's where the
it's on
pills
every single pill.
Yep, that's every single pill.
Oh my gosh.
And then
wow.
there are the pills right there.
They're kind of big.
They're big. Well, not really too bad.
Do you just take one a day?
I take 2 a day. Yeah. And then you can see at the top again, there's that
pregnant thing.
And then on the back, it talks about some of the side effects. And then down here at the bottom for women, it also talks about what can happen if you get pregnant while you're on this medicine. You can't get pregnant while you're on this medicine because it causes such severe side effects.
Yeah.
You would have to terminate.
Oh wow! Really?
Yes.
So you can't choose to not.
Say that again.
Do you get the decision to terminate
or
not?
The side effects are so severe that they've had women with babies born with the arm coming out of their head, the heart side of the body, limbs missing, deformed face. It's a bad deal.
That's crazy.
Horrible.
Yeah.
I mean, I knew there was birth defects. I didn't know it was that bad.
Yeah.
Me either.
Says here, severe internal defects that you cannot see, involving the brain, lower IQ scores, heart, glands, and nervous system. And you can see that kind of the head, how,
it's
kind of cone it is. Yeah. So severe side effects there. But you can talk more about that with Britt and Dr. Schultz.
Yeah, we have questions planned for her.
Good.
About that. So, okay, one more question. I know that women have to go in and get blood tests. Do you have to do that every month?
I do.
Oh, okay, so it's not just women.
Right. No, I have to go in every month. It is going to start to go every other month because they can be a little more relaxed with men.
Yeah, but it probably won't be like that for women.
Right. Yeah. Mm-hmm.
Awesome. Do you have any questions, Madison?
I think you got it all.
Do you have any, Scott?
No.
Okay.
You have to tell me what your grade is on it when you've been on.
Okay, it will be an A for sure.
All right.
Okay, thank you for coming on our podcast.
Yeah, it was nice to meet you. Thank you.
All right, nice to meet you too.
Yes, thank you. Bye.
Bye, girl.
Bye.
Bye.
Bye.